Good day, and we are continuing with Mother Baby Friendly Initiative. I'm still Anna Nolte, and we're still busy with lesson one. In this part, we're going to talk about the motivating the change by using the correct counseling and communication skills. In this part 2A, which we are going to do in this series of slides, we're going to specifically talk about counseling and communication skills. We're going to talk about counseling in general first, and then we're going to talk about using listening and learning skills whenever we are engaging in a conversation with a mother. And this is extremely important. I think the way in which we communicate with the mother can never be underestimated. The messages that we carry over to her in a verbal and as well as a non-verbal way is extremely important. So, and this is whether we are whenever we communicate with her, when we try to convince her that breastfeeding is the best way of feeding, or whether we're teaching her the different breastfeeding skills. In all of these, we have to use the correct counseling and communication skills. Now, I'm sure this to you in most of your cases is revision. I think we've all done communication skills to a large extent in our basic training. I think we've all done certain listening skills and communication skills. So I hope that in most cases it's just revision. If it's new knowledge to you, it's 100% wonderful. The important thing about this is, again, this needs to be practiced. I can teach you all the different theoretical knowledge about this, but this is something that you need to practice in your everyday communication with whoever you are communicating. So just to be more aware of how you are communicating already makes this the worth the while. Now, I've said we're going to talk about counseling in general first before we talk about the communication skills. So if we define breastfeeding counseling, it's a conversation where someone with appropriate training listens and responds to a woman's thoughts and feelings related to feeding while respecting her personal situation. And this is very important. The things that's been highlighted in yellow are the very important things. It's a conversation with the mother where we use our communication skills and we have the appropriate training not only to communicate well, but also regarding the knowledge that we are communicating to her. And then very important is the mother's thoughts and feelings. We're not only dealing with knowledge. I think there's the whole breastfeeding thing is a very emotional thing. And I think all of you who are working and have worked with mothers regarding breastfeeding are very aware of that. Especially first-time mothers lack a lot of confidence. They feel guilty about every possible thing. So we have to be very sensitive in whenever we are communicating to these mothers and to respect their personal situation and wishes. As I've said in the first lesson, we are not forcing things on mothers. We are, and that is why counseling and communication is so important. We need to bring over the correct message to her, and what she does with this message then is her choice. So counseling should provide education, reassurance, skilled practical help and problem-solving anticipatory guidance in the antenatal, birth and postpartum periods. We will see that, and I think in your case in the private hospitals, patients are not always you're not having contact with them during the antenatal period. But whenever you get contact with them or make contact with them during the antenatal period, communication about breastfeeding is extremely important. Birth and postpartum, because it's usually during the antenatal period that the mothers make their decisions regarding the way that they're going to feed their baby. This counseling should be accessible and available all the time, and that is so important. And it doesn't matter whether there's an emergency or whether there's a humanitarian crisis like a war or load shedding or a whatever, mothers need to get their counseling regarding breastfeeding. And consistency, excuse me, we talked about consistency in the first part of the first lesson as well. The message that we convey should be consistent. I can't say something totally different than my colleague that's coming just after me. So as far as quality and quantity is concerned, it should be consistent, and it doesn't matter what kind of individual we are talking about, where they're coming from, what their ethnicity is, their gender or their race or whatever. Now, skilled breastfeeding counseling consists of information that we give, we answer questions, we overcome challenges, and I think that we do all the time in first breastfeeding mothers. We give correct and up-to-date information, and that's why you are doing this course, that you can, well, be able to give the correct and up-to-date information so that the mothers can make the correct informed decision. It gives ongoing skilled support, and this is very important after breastfeeding has initiated. We all know that, again, especially in first-time breastfeeding mothers, they need a lot of support. Builds breastfeeding knowledge and confidence, and specifically confidence. And when we get to the lessons on the anatomy and the physiology, you will see how very important role this confidence plays in the whole breastfeeding process. Improves breastfeeding technique because then they get the correct knowledge, they get the correct support, etc., and provides troubleshooting for common challenges and help them to solve their problems. Now, what I have here is what is being prescribed by WHO and being supported by our Department of Health, is access to quality skilled breastfeeding counseling. At least 6 contacts is important during pregnancy, postpartum, and through the first years of infant life. Now, to make it practical in your private hospital situation, it's very difficult often to, as I've said, to meet women during pregnancy. And in the private hospital, I think many more mothers get many more than 6 contacts. But in the public sector, I think when they are being discharged so very quickly, they don't even always get 1 or 2 contacts, never mind 6 contacts. And then throughout the first 2 years of life is very important. Now, from a private hospital perspective, it's going to be difficult to provide this to them, but we will talk about that at the later stage in the sense of the support that we provide to them or that we help them to get when they are being discharged. And all hospitals that is providing mother and baby care should be able to provide skilled breastfeeding counseling. That's very important, and that's why you are all doing this course. Why should they get breastfeeding counseling? Now, here I think the most important thing is obviously that the mothers should get the correct information from a person that's very skillful. And then it has been proven, and there's evidence, that by providing antenatal and postnatal breastfeeding counseling, it can increase exclusive breastfeeding by 48%. And there's evidence and research that has proven that by proper counseling, the exclusive breastfeeding percentage can definitely be increased. And also, it increases the possibility that mothers will be able to give their first breastfeeding within the first hour after birth by 42%. Now, the reason why counseling increases mothers to initiate breastfeeding early is, again, because they have the necessary knowledge and because they're motivated to put their babies to breast as soon as possible after birth. Now, the other reasons why breastfeeding counseling is also very important is some women face severe breastfeeding challenges, and we all know how often mothers are struggling with breastfeeding, babies that don't want to latch, engorged breast. So this is where it's so important that they require and receive specialized support from the providers with more training in lactation than what they have. And then especially also after discharge from hospital. And as I've said, we will definitely talk about that again, because we all know that breastfeeding seldomly is really established by the time, especially with mothers that are struggling, by the time when they are being discharged from hospital. So they need support and further counseling whenever they're being discharged. Illnesses and prematurity and other complex clinical situations are also areas where mothers need a lot of breastfeeding counseling. And then again, hospital midwives should be connected to a broad network of providers with specialized breastfeeding skills for referrals. So as I've said again, we will talk about this, but it becomes more and more with this Mother Baby Friendly initiative, your responsibility to see that the mother will be connected at least to further support after she has been discharged. Okay, now we're going to come to the listening and the learning skills. And this, as I've said, is very important because in a way, when we are counseling people, we try to understand how they feel and we try to understand what their problems are. And when we understand what their problems are, we can help them to decide what they think is best to do in this situation, with the emphasis on that, to help them to decide. We're not deciding for them, they decide. And then very important, the mother, it's not always, breastfeeding is quite a sensitive topic, as we've said, and as we will say many more times. And in many cases, and this is also very culturally related, mothers are very shy and it's not easy for them to talk about this. So we will need the skills to listen and to make her feel that we are interested in her and that we really understand what her feelings are. And this will encourage her to tell you more instead of being turned off and to say nothing further. Now, just a practice, just a reminder almost for you about what real role listening skills play. Now, after you've done this video, after you've checked this video, tell somebody a story. It can be a gossip story, it can be any story. And see how it makes you feel when the other person listens to you, or if it feels to you that the other person listens to you. Or how does it feel if you become aware that the other person is not listening to you? And how do you become aware that the other person is not listening to you? And I really challenge you to do this. As I've said previously, these are the skills that I'm going to teach you now are all skills that we need to practice. And we're supposed to do it in our everyday communication, whether we communicate with our friends or our partners or hospital patients or mothers who are breastfeeding, it doesn't matter. It's everyday kind of communication skills. So we have to practice, and you have to practice that in your everyday communication. Now we're going to do 6 listening and learning skills. Helpful non-verbal communication, open questions, use responses and gestures that show interest, reflect back on what the mother and the caregiver says, empathize, and avoid using words that sound judging. Now, if you look at this, it sounds as if we all know how to communicate, but let's see whether we really do. First of all, using helpful non-verbal communication. Now, non-verbal communication, you all know, means showing your attitude through your posture, your expression, everything except through speaking. That's how your body tells the other person what you think or doing about this communication. And helpful nonverbal communication makes a mother feel that you are interested in her. If you think about our example of you telling a story and you look at the other person to see whether the other person is interested in your story or not, just look at how many nonverbal cues you get from the other person to say that the other person is listening to you. And this nonverbal cues often gives the mother or tells the mother that we approve or disapprove of a situation. And we nurses are excellent on showing our nonverbal communication to patients when we disapprove of a situation. So we should be very, very careful with that. And specifically, as I've said previously, breastfeeding is a very sensitive topic, but it's also very much religion, culture, feelings, emotions, etc. related. So it is very important that we are aware of how we communicate to the mother. Now, which helpful nonverbal communication skills can we use? To keep your head level, excuse me, and we will go through, excuse me, we will go through each one of them separately. To pay attention, to remove physical barriers, to take time to allow the mother or the caregiver time to talk and use appropriate touch. Okay, if we look at the examples of this non-verbal communication, for example, posture, we know that it's very important to be at the same level as the person that we're talking to and to be close to them. We can't talk to somebody about a sensitive topic when we start standing in the door of the ward and shout to her that she must put the baby to the breast, or is she having any problems, etc. Eye contact, and we will talk a little bit more about eye contact specifically, but that tells you that the person is listening to you, that you are that you're giving attention to the person. Remove physical barriers, and we will talk about that just now. Very important to take time. Again, that's one of the things that nurses are very specialized in, to look very hurried. To look, we are so busy and we have such a lot of things to do, I can't really listen to you now. So please be very careful with this, and we will come to that just now again. And then touch an appropriate way. As I've said, breastfeeding is very related to emotions, to religion, to culture. So there are inappropriate and appropriate ways to touch a mother when we are doing breastfeeding. So we will give definite attention to that as well. Okay, so if we look further to all these ways of non-verbal communication, the things that hinders communication regarding our posture is when we stand with our head higher than the other person. It's always, and this is also culturally very important, creates the impression that you are talking down on to the other person. So you should be at the level of the other person. Sit when the other person is sitting, sit with the other person, sit at the same level as the other person, and keep your head level to the mother. Eye contact is very important. Eye contact that hinders communication is when you look away at something else, or down at your notes, or it's obvious that you're not interested in what the mother is saying. It helps if you can look at her and pay attention when she speaks. Now, the eye contact is very important also regarding different cultures. It means different thing in different cultures. So one must also make sure that you understand eye contact very clearly when you are talking to mothers from different cultures. Barriers, like sitting behind the table, can be a hindrance, or writing your notes while you talk. I think all of you know how irritating it can be when you're talking about a very important topic to somebody else and the other person is writing. So, and again, note this when you are busy with communication with other people, excuse me, what they are doing to you as well. Excuse me. So the important thing is to remove the barrier, to remove the table, sit at the same side as the patient, or remove the notes, or at least look up while she's talking, and then you can make the notes afterwards. Taking time, I've said, is one of our big problems. Be in a hurry. Greet her quickly, show her signs of impatience, continuously look at your watch. This is very important. Now, I have a lot of empathy with you regarding time and being in a hurry. I know it's one of the most difficult things to really spend time with a very enthusiastic mother to help her to latch the baby if there are 10 other mothers who are also equally enthusiastic and want their babies to be latched. But we have to make time to each and every mother so that we can help her properly and help her to make her feel that we understand and that we are caring about her specifically. I know, as I'm saying, it's one of the most difficult things. So that's one of your challenges regarding breastfeeding. I will say it often, I will say it many times through this lesson as well. But what I think also helps a lot is to choose a mentor. There are, in all postnatal wards, in all maternity sections, there are always midwives who are very keen to help mothers breastfeed, and they are great lactation consultants. Look at them. They are always willing to spend time with mothers. They have patience with mothers. They're kind and soft with mothers. So just look at them. Just observe them when they are talking to the mothers, and you will see. And do what they do. Okay, then touch, as I've said, there are inappropriate and appropriate ways to touch a mother because, I mean, breasts are a sensitive sexual part of a woman's body. So many women can be very sensitive about how you touch her breasts. So it might be always a good idea to ask for permission once you touch her or when you want to show her how to latch the baby, instead of just touching her breast and showing her and how to do it. Just ask for permission first. And even touch, like you see on this picture here in front of you on the right hand side, has also different meanings to different people, and different people have different personal spaces. So one must be also very sensitive to the other person's a personal space. Some of us love to hug and to touch other people. Other people don't like to be hugged and touched. So I think that's, as I'm saying, a very sensitive thing that we need to find out. Again, in your daily communication with people, be aware of that. Be aware of what you like, how you like other people to touch you, and how you can touch other people. So what would be inappropriate touch for you and what would be inappropriate touch for a breastfeeding mother? Our second skill is verbal communication, how to ask open questions. We ask many questions when we are communicating in our everyday life, and we also ask many questions when we are dealing with breastfeeding mothers because we want information from them. We want to understand what's going on. So therefore, it's very important for us to ask questions and to communicate verbally to them with words. Now here it's very important, and I think we all know it, what the tone of your voice is saying. The tone of your voice says a lot. So we should also be, again, very aware of our voice tones or tones of our voices, and we should try to sound as gentle and kind as possible when we are talking to breastfeeding mothers. Again, I'm going to say this also 100 times. Mothers, first-time mothers who are doing breastfeeding often lack confidence. They don't know whether they are on the right track, whether they're doing things correctly. So your tone of your voice and the way in which you communicate to them can communicate a lot of things to them. And then, as I've said, we try to find out how people feel. We are really interested in their feelings as well. So we need often to probe deeper to find out what their real worries and their real concerns are. And we will talk a little bit more about that. Now, as I've said, we ask many questions. And when we ask questions, we try to get as much as possible information. Now, we have said that time is one of our biggest problems. So when we're asking questions, we also try to save time by getting as much as possible information as from the first question that we are asking. So that's very important. And that is what's the difference between open questions and closed questions. Now, open questions usually start with how, what, when, where, why, who, all the W's that we have also learned a lot about when we are smaller. So when we ask the mothers these type of questions, they have to give us some information, opposed to closed questions. In closed questions, we usually only get the answer, a yes or a no answer. Closed questions usually start with, are you? Are you breastfeeding your baby? Yes. Did he drink well this morning? Yes. Has he slept through the night? Yes. And we don't get any other information. So that now we have to ask more questions to get more information. And when we ask, the more closed questions we ask, the more the mother will come to a point where she's not really keen to answer you anymore and willing to give you any more information. So if you ask the mother, for example, whether she breastfeeds exclusively, and she just says yes, if you continue to ask questions like that, she can become frustrated. Now, here's some examples of some closed questions. You, a health worker, come to the mother and you say, good morning, I am the community wife. Is your child well? And then the mother says, yes, thank you. Are you breastfeeding him? Yes. Are you having any difficulties? No. Is he breastfeeding very often? Yes. So you only got yes and no answers. Excuse me. If we look at the example where you ask open questions, health worker comes again. Good morning. I'm the midwife. How's your child? And the mother says she's well and she's very hungry. She immediately gave more information. Health worker, tell me, how are you feeding her? She's breastfeeding. I just have to give her 1 bottle feed in the evenings. What made you to decide to do that? She wants to feed too much at the time, so I thought that my milk is enough. So you can see here, you had much more information than what the previous midwife got when she just asked yes and no questions. Here's another example of open questions and where you continue with the conversation and get more information. The health worker again. Good morning. How are you and your child? Oh, we are both doing very well, thank you. How old is the child now? He's 2 years old today. What are you feeding him on? He's on breastfeeding and having drinks of water. What made you decide to give him water? There's no milk in my breasts and he doesn't want to suck. Now here we had open questions, we had open answers, but did you get, I almost want to call it effective information. All this information that we get here on this, is the information on this in this example of any value for you? Let's look at the next example. So as I've said on the previous slide with the example, you see here that the health worker has asked many open questions, but it did not really help her. So the questions that we do ask are very important to get as much as possible information the time that we ask the question. Our next skill is to use responses and gestures that show interest. I think all of you are very aware of that. The gestures that show, and as the previous example where I've told you to tell a story, you will carefully look at what the other person does to tell you that he or she is interested in what you are saying. For example, nod, yes, I hear what you're saying, or say, uh-huh, yes, etc. We all know those gestures. And this is just an example again of using the responses and gestures. As the health worker says, good morning, how's the child? Now that she has started solids, the mother says, good morning, she's fine, I think. And the health worker says, she nods and she smiles. And she waits and the mother will obviously give her more information. I was a bit worried the other day because she vomited. Oh dear, and she raises her eyebrows and she looks interested, and the mother will be motivated to give more information. I wondered if it was not something in the stew that I gave her. Aha, says the health worker, and she nods sympathetically. Here the health worker asked a question to start the conversation, and then she encouraged the mother by her gestures to continue with the conversation. Our fourth skill is to reflect back what the mother or the caregiver says, and this is one of the best communication skills, not always the easiest one. Because when we reflect back on what the mother says, we make sure that we understand the questions correctly or that we understand what the mother says correctly, and it also helps the mother uh, uh, um, to give us more information. So we, as we're saying here, that health workers sometimes ask mothers a lot of factual questions, like we've seen on the previous slide, where you get a lot of information, but the information is not really helpful. So what we like, for example, in this one, my baby was crying too much last night, and you ask how many times did the baby wake up, but the answer is not really helpful. So if we reflect back on what the mother is saying, for example, you say, the mother says at the bottom here, I don't know what to feed my baby. She refuses everything. You could reflect back on saying, your child is refusing all the food that you offer her. And this shows the mother that you are listening to her. It clarifies that you have heard her correct, and it encourages the mother to give you more information. It's just, as I'm saying, not the easiest communication skill, and this is something that you really should practice, and also challenge yourself to use it a lot, and you will see that you get much more information than what you normally get. The very important thing is not to repeat verbally what the mother has said. So you're not going to say again, I don't know what to feed my child, she refuses everything, and then you say she refuses everything, and then the mother says another statement, and you repeat it verbally again. So rephrase what the mother is saying, but using the same information and almost the same words. Like, for example, good morning, how are you and your child today? The mother says he wants to feed too much. He's taking my breast all the time. How often would you say, this is now not reflection, I would say about every half an hour. Does he want to suck at night too? Yes. So here you ask a lot of factual questions and again, you got no information. Now we use reflection. Good morning, how are you and your child? She wants to feed too much. She's taking my breast all the time. Now you reflect on this. Your child is feeding very often. You see, it's not the exact same words, but it is the same meaning. The main important thing that we get out of this statement that the mother is making is that the baby is feeding too much. And that is what you are reflecting on. Then the mother says, this week she's so hungry, I think my milk is drying up. Now, one can very quickly reflect and focus on the not important thing. The fact that the baby is hungry, the more hungry, is the more important thing. The fact that there's possibly not lots of milk for her. So we are reflecting back on that. She seems more hungry this week. Yes, and my sister is telling me that I should give her some bottle feeds as well. Your sister says that she needs something more. Which formula is best? Then the mother can ask. And then you have now, and what's also very important and very helpful with reflection is that you often get the feeling of how the mother feels when you are reflecting. And we will see that just more just now. Together with reflection, the two to a very large extent goes together is reflection together with empathize. Um, what you are doing is that you show that mother that you understand how she feels. But you are showing that you understand how she feels. You're not telling her how you feel. And that's very important when we are using empathy. It's a difficult skill to learn, and it's difficult for people to talk about their feelings. So that it's much easier for the mother to give you facts. So it's very important when we are communicating to the mothers to make sure that we understand how they feel as well. So when a mother says something that shows how she feels, it's helpful to respond in that way. I almost want to say, to major on that feeling. For example, if the mother says, my baby wants to feed very often and it makes me feel so tired. The fact that the baby feeds very often is important in this sentence. But what's very important here is almost the mother's desperation. She feels so tired. So this is what you need to focus on now. And this is what you need to reflect on. You are feeling very tired all the time. This tells you that, or this tells the mother that you understand how she feels, and then she will give you more information on how she feels. Empathy is different from sympathy. In sympathy, you sympathize with her, you say you're sorry, and you're actually doing it from your point of view. You will say to the mother, but for example, I understand exactly how you feel. My baby always wanted to feed too much, and I always felt tired. How do you feel when you say to somebody, I am so tired, I'm so depressed, I'm so whatever, and the other person say, I understand how you feel, I feel as depressed as you are. I think I would have been very annoyed. So as we've said on the previous slide, if you sympathize, you might have said, I know exactly how you feel. My baby also wanted to feed too often, and I felt exhausted. And as we've said, this brings the attention back to you and does not make the mother feel that you understand her. Now, what is very important here is reflection is not only reflection, and empathy is not only empathy. We need to make sure that we reflect and empathize the mother's feelings, that we reflect and concentrate on the right thing. For example, when the mother says he wants to feed very often, but this reflects that the mother said, about the baby's behavior and not how she feels. She feels tired. So we need to reflect on how she feels. This is very important here because she feels tired. She's depressed about the fact that the baby needs feed more often. So what we need to give attention now on is on the mother's feelings. And what I'm saying in this second last sentence is also very important, is that we need to it's helpful to empathize also with the mother's good feelings, to also reflect on what she's doing well and how she's feeling when she feels well. Just another demonstration to demonstrate the difference between sympathy and empathy. The health worker comes in and say, good morning, how are you and your child today? And the mother says, the child is not feeding well. I'm worried he's ill. And the health worker says, I understand how you feel. When my child was ill, I was also worried. I know exactly how you feel. Now, in the first place, you're just saying how you felt. You don't get any information from the mother. You're not telling the mother that you're understanding her very well. And you're also focusing on the wrong thing. The thing is that she's focused, that she's worried. So that's the one thing that you should really focus on. Now, another example where we use empathy. Good morning, how are you and your child today? Mother, the child is not feeling well. I'm worried he's ill. And now we reflect on and empathize about the fact that she's worried about them. So we say, you are worried about them. Yes, as some of the children in the village are ill, and I'm frightened he might have the same illness. So here we get a lot of information from the mother just because we reflected on a feeling. We empathized with a feeling that she's worried about them. And then the health workers say it must be very frightening to you. And she's further exploring the feeling of the mother that she's worried. So here she's twice focused on the worried about them, and the fact that it's frightening for her is the second version of the fact that the mother that she understands that the mother is worried about the child. Now here is another example where the health worker asks a lot of questions without ignoring the mother and ignoring the mother's feelings and without getting any information from the mother. For example, she asks, "Good morning, how are you and your child today?" The mother is refusing to mother says she's refusing to breastfeed since he started eating porridge and other foods last week. He just pulls away from me and doesn't want me. So the health worker says, "How old is the child's name now?" 7 months old. So you see, again, they're focusing on totally wrong things. And how much porridge does she eat during the day? That's not what the mother is saying. So again, the health worker focuses on facts and ignores the mother's feelings, and we don't get the correct information. Empathy, how would we show empathy in this same example? Good morning, how are you and your child today? She's refusing to breastfeed since she started eating porridge and other foods last week, and she just pulls away from me and doesn't want me. And then the health worker reflects on what is wrong. It's very upsetting when your baby doesn't want to breastfeed. Or you could even say it's very upsetting when the baby pulls away from you. And then the mother says, "Yes, I feel rejected," because you concentrated on the fact that she feels unhappy about that the baby is not breastfeeding. She's not unhappy about the breastfeeding as such, the feeding as such, but the fact that the baby is pulling away from her. So we, again, in this version, the mother's feelings were listened to and we gave the correct attention to it. And then our last skill, and I think we all very aware of using words that sound judging. We are very aware when we are communicating with other people, when they are saying things that we feel is judgmental. And the words specifically in breastfeeding, where mothers so lack confidence or so often lack confidence, are words like right, wrong, well, badly, enough, properly. Have you fed your baby properly? Have you given your baby? Did your baby drink enough, etc., which might very quickly sound to mothers like judging questions. So this is very important. For example, don't say, "Are you feeding your child properly?" The properly already tells them that you are doubting the fact that she's doing it well. Rather ask, "How are you feeding your child?" which is a very neutral question, and you will get much more information and the mother will be much more open to communicate to you than when you ask properly. Or when you ask, "Do you give the baby enough milk?" Enough milk is already, I think most mothers always doubt whether they are giving their babies enough milk, and immediately it might sound judgmental to them. Instead say, "How often do you give your baby milk?" Or ask about other signs that the baby is drinking enough. Here's a demonstration, an example of where judging words are also being used. The health workers say, "Good morning, is breastfeeding normally? Is the baby breastfeeding normally?" The mother says, "Well, I think so." "Do you think that you have enough breast milk for him?" "Enough?" "I don't know, I hope so, but maybe not." And she looks worried. I told you just now that mothers are always worried about the enough word. So the moment that you say enough word, she might feel worried. And then you ask another question, "Has he gained weight well this month?" And that's also one of the things that mothers are very sensitive about this. "I don't know." And you ask, "May I see his growth chart?" And again, the health worker hasn't learned anything useful, but she made the mother more worried and sensitive and feeling being judged as an unworthy mother. Example of not using judging words, the same example. Good morning, how's breastfeeding going for you and your child? The mother, it's going very well. I haven't needed to give her anything else. So you see, immediately it's a very neutral question. How's breastfeeding going for you? And then the mother can say, it's going well, or it's going well, badly, or she's not drinking enough, or whatever. How's her weight? Again, not asking whether she's gaining enough weight or more weight or less weight, but a very neutral question. Can I see how's her weight, and can I see a growth chart? And then the mother says, the nurse, she said that she gained more than half a kilo this month, and I was pleased. So, and the health worker says she's obviously getting all the breast milk that she needs. And this time you have learned much more without making the mother worried, without making the mother feel that she is being judged by you. And very important is that you might have noticed that most of the judging questions are often closed questions. Have you given enough milk? Have you fed properly, etc.? Open questions, and specifically when you use reflection, is always the best way to communicate to avoid judgment. And that brings us to the end of this session, part 2A. I hope that you've learned something. And as I've said, I challenge you to become more aware of your own communication skills, and then practice them. Make the things that you experience as wrong, correct them, and also listen to how other people communicate to you. Listen to how other midwives communicate to mothers when they're helping them breastfeeding.